One of the most important aspects of maintaining wellness is how to tackle problems that come up related to health issues. By its very nature, serious illness is largely unanticipated. A reaction to serious diseases such as heart disease or cancer, or long-term conditions such as arthritis, or progressive neuromuscular disease or diabetes may well determine very survival, or at a minimum, the future quality of our life. When illness strikes, it is not uncommon to experience feelings of a reduction in or loss of control over our daily life. To some extent, that is inevitable. However, the degree to which you experience a loss of control can be directly affected by the amount of your personal participation you assume during the course of your illness. One of the most powerful ways to do that is through personal or self-advocacy. What is self-advocacy, and why is it so important to ultimate wellness? Advocacy in a healthcare environment is a process of supporting and enabling yourself or a caregiver to ask questions, express your views, thoughts, and concerns to affect a change. It also includes having access to relevant information, seeking advice, and receiving guidance. Exploring your resources can facilitate revealing better choices and options for services and care, thereby maximizing your chances of achieving wellness. Self-advocacy is an active process that requires effective negotiation for additional resources, revolve around your preparedness, prioritization, and perspective. This entails that you collaborate and connect with your healthcare team and communicate your thoughts succinctly. Unfortunately, for a variety of reasons, mistakes occur in the often hectic medical environment characterized by humans, machines, computerized records, and the interaction of all three. The consequences of these mistakes can be disastrous or relatively minor in nature. As a patient, it is imperative that you or your caregiver be cognizant of the care or changes in care that you receive. The ultimate goal of self-advocacy is the return you to wellness in whatever form that may take. Engaging with today's healthcare systems, which are often large and difficult to navigate, may leave patients feeling intimidated. Depending on the illness, obtaining the appropriate care can involve interaction with multiple levels within the healthcare system. Some examples include, but are not limited to, insurance coverage, numerous specialties and subspecialties, teams of health providers including doctors, nurses, hospitalists, education providers, social workers, pharmacists, dietitians, and occupational or physical therapists. All or some of these individuals may have a role in creating complex care plans, providing or delivering treatment options, conducting diagnostic tests, monitoring progress, making adjustments, evaluating overall level of functioning, and preparing aftercare or follow-up strategies. The purpose of these discussions is to enable you to achieve and maintain optimal wellness throughout your lifetime. To accomplish this, you will be given a number of strategies and tools that will be helpful in achieving your personal wellness goals. Ironically, creative wellness is multifaceted and begins with your lifestyle choices, doc, and your relationship with yourself. If you have ever been to a doctor, you're probably familiar with the pillar of good health: diet, exercise, sleep, avoiding drugs, social community. Journey to maintaining good health through advocacy. The first step in achieving wellness is to begin your personal health advocacy by being proactive. Start by purchasing a health notebook to journal all relevant health information. Relevant information should include the name, telephone numbers, and addresses of your healthcare providers, the name, telephone number, and location of your pharmacy and health insurance data, e.g., name of provider, insurance number, type of coverage. First, you will want to obtain your blood relative's family's medical history. To do so, you will need to collect information about your parents, siblings, aunts, uncles, and grandparents. If you are married, include your spouse because you share the same environment. Ideally, want to include your relative's birth date, date of death, if applicable, and cause of death. The purpose of creating this record is so that your doctor is able to best treat you by having knowledge about your heritability risk of contracting certain illnesses that are passed down by family members. The doctor may monitor you regularly or periodically for these conditions, prescribe special tests to identify genetic factors or markers in your blood, prescribe medications or suggest preemptive measures for you to take to avoid or minimize your chance of contracting a disease. Below are some common diseases you may want to ask your blood relatives about. The more information you obtain from family members about their disease conditions and personal habits that affect overall health, the better your doctor will be able to help you stay healthy. Prevention is the key to good health. You may need to do some sleuthing to find health information for deceased or older relatives. Asking family members to act as informants, sharing family stories, and corroborating facts will go a long way in achieving an accurate family history. Examining behaviors that may not seem connected to the presence of a disease are also important in evaluating disease status. Habits like smoking, alcohol use, poor sleep, or dietary habits may have a profound impact. The onset, duration, or severity of a condition, such as high blood pressure. Untreated high blood pressure may in turn lead to heart disease or stroke. You will need to probe your family members about their health conditions by asking the age that they received their diagnosis, how long did the condition last, how severe was it, what kind of symptoms did they experience, did they receive treatment, what was the treatment, was the treatment effective, and were they under the regular care of a doctor? Being a good listener and asking follow-up questions or asking for clarification are your best strategies for obtaining a comprehensive family health history. Additionally, following up on family members' conditions is also essential in updating your doctor with the most current information. Providing this kind of detailed information to your doctor at your first visit or any subsequent visit lets your doctor know you are serious about your health. The second step in maintaining optimal health is journaling our own health history. Good communication is critical to achieving good health by recording past or ongoing illnesses or conditions. It's not necessary to go back to your birth unless there is a health issue that is currently relevant. Depending on your age, if possible, it is a good idea to include common childhood diseases such as measles, mumps, chickenpox, polio, etc., as well as vaccination records, if available. You will also want to include past surgeries like tonsil removal, sport or work injury, e.g., orthoscopic knee surgery, carpal tunnel syndrome for repetitive movement, repair of broken bones, etc. In the case of past surgeries, you want to indicate the date surgery was performed, hospital name, length of stay, name of surgeons, brief description cause, any surgical complications and outcome of procedure. The more information you can provide healthcare providers, the more likely it is that you will achieve optimal health in the long run. Your primary focus in journaling is going to be on ongoing or acute illness and your characterization of them. With a chronic diagnosis, you will need to indicate whether the occurrence is constant or intermittent. With a condition that recurs, when and why it appears is important in establishing a pattern of occurrence, be it chronic or intermittent. This will establish the best treatment. For example, let's say you have seasonal allergies. This is a chronic intermittent condition for which you will want to include a variety of symptoms to best characterize your current occurrence. This will include date of onset, offset, duration of symptoms, e.g., days, weeks, month, severity or intensity, e.g., mild, moderate, severe, nature of symptoms, e.g., runny nose, itchy eyes, headache, cough, sinus drainage, etc., and any environmental triggers, e.g., temperature, precipitation, pollen, mold counts, etc. Also include any actions taken to mitigate these effects, e.g., nasal spray, eye drops and antihistamines, staying indoors, etc. Recording this in your health journal will help you to remember and provide your doctor with the most accurate, detailed account of the incident. The same type of observations should be applied when an acute illness occurs. This kind of detail will not only help the doctor in reaching a correct diagnosis, but also help in getting an appointment more quickly. In addition to providing information about health issues, it is important to have a complete record of any medications, herbal remedy, vitamins, or supplements you're taking. You want to include all prescriptions and over-the-counter medicines you take, whether they are taken regularly or as needed. Essential details about each drug, vitamin, herbal remedy, or supplement you take should include name, purpose of drug, start-stop dates, dosage, i.e., milligrams, grams, milliliters, frequency of usage, i.e., daily, weekly, monthly, daily, weekly, monthly, number of times taken within a specific time frame, i.e., morning, evening, every 6 or 8 hours, how many pills taken at single dosing, and if they are taken with food or on an empty stomach. Bring your most current medication list to each visit. You will want to monitor your own usage between visits and write down any unusual drug-related symptoms. Record any advice or changes the doctor may make to your medications and supplement regime during your visit. Sometimes taking a medication can be complicated, e.g., take 2 pills per day for the first 3 days, then 1 pill a day thereafter until the pills are gone. Our memories are fallible, so it's a good practice to write down the doctor's instructions. It is also a good idea to repeat the doctor's instructions back to him to make sure you have an accurate understanding of what is being communicated. Filling your prescription in a timely fashion and following the instructions written on the label, taking medication as directed and not substituting some else's pills, or doubling your dosage, i.e., if 1 pill works well, 2 pills should work even better, are critical components in being proactive and achieving the optimal outcome. Almost any substance you ingest or apply externally has the potential to produce a reaction with your body. Some of your body's responses to medications are anticipated and desired, while others are not. For example, drinking a recommended amount of water facilitates hydration and assists in flushing out toxins from the body, whereas drinking an excessive amount of water may result in a disruption of electrolyte balance, resulting in mental confusion. Have you experienced any adverse side effects? These symptoms may include, but are not limited to, nausea, blurred vision, increased heart rate, stomach or bowel changes, change in appetite, excessive sweating, sleep disturbances, dizziness, fatigue, coughing, and behavior changes such as increased irritability, anxiety, or feeling down or blue. If your doctor prescribes a new medication or changes the dosage of an existing medication, you will want to ask, what are your risks? What are the most common side effects? Is this safe for a person my age? How long will it take to work? Are there refills? Is there a generic version available? Are there any restrictions or activities that will affect the drug's potency, i.e., alcohol or food consumption, sun exposure, etc.? Are there any interactions with supplements or other medications I am taking? If you do experience a medication side effect, be sure to record it in your health journal in as much detail as possible. Note how long it occurred after taking the medicine and whether the symptoms were mild, moderate, or severe, and as well as their duration. Anytime you have a side effect that impedes your ability to function, e.g., difficulty breathing, loss of mobility, extreme vertigo, Call your doctor, an acute care clinic, or a pharmacist to receive advice. Another tool to promote your personal health advocacy when taking medication or any type of vitamin, supplement, or over-the-counter product is to consult your pharmacist. They are the experts and often have a better understanding of the chemical properties and potential interactions of drugs with vitamins, supplements, and over-the-counter products than does your doctor. If you have been prescribed a new medication, the pharmacist can relay what the most common side effects to expect are and how to manage or avoid them. They can also provide additional information pertaining to warnings that appear on the labels in small print on the side of the bottle. You should inquire if a generic drug is available and ask the pharmacist to call your doctor and ask if it is acceptable to substitute the generic for the original. You should also ask the pharmacist to look at your current medication record online to make sure that nothing you are currently taking will interact with the new medication. This is important because estimates range between 44,000 and 98,000 people dying from medication errors annually, and another million plus who become seriously ill from medication errors. Not all over-the-counter products and vitamins are federally regulated. This means they may not all contain the listed amount of their active ingredients. Pharmacists can be an excellent resource for purchasing vitamins and other non-prescription products. If, for example, you have a cold, you can tell your pharmacist what symptoms you have, and they should be able to make a professional recommendation as to what product is most effective and appropriate. The more knowledge you have, the greater the chances are that you will have an effective and healthy outcome. The pharmaceutical industry is constantly introducing new drugs, modifying and improving existing drugs, as well as extending methods of delivery, i.e., injections, infusions, liquid, capsules, or introducing off-label uses, e.g., weight loss use for an FDA-approved drug for diabetes. If you are drug-sensitive or prescribed an off-label drug, ask about the medication and read the drug sheet inserts before you put anything into your body. If you don't understand or are unsure about what you read or what to expect, ask your doctor or pharmacist for further clarification. The time to educate yourself about your medications is valuable in that it may prevent an adverse event from occurring. Prevention health screenings. Another aspect of personal healthcare advocacy is that of remaining current on your health screenings. Primary screenings are diagnostic tests or examinations of potential health issues that are done before symptoms occur, thus focusing on preventing disease, e.g., blood pressure or cholesterol tests. Secondary screenings attempt to detect diseases early when you are still asymptomatic, e.g., mammogram, colonoscopy. Tertiary screenings entails monitoring and prevention of complications for existing health issues and treatments, e.g., change in A1C levels for diabetes. Your primary care physician often includes a number of screens as a part of your annual checkup. Routine screening helps identify patients at increased risk for a variety of health issues. Screens regularly included during an office visit include weight, height, blood pressure, skin checks, reflexes, balance tests, eye test, listening to your heartbeat, and physical exams, blood tests, and questions about falls, mood, alcohol, and nicotine consumption. Initial screens are used to establish a baseline level, with subsequent screenings given to monitor significant changes from the patient's baseline levels. Changes in baseline screening levels are often associated with family history events, genetic risks, age and aging, gender, ethnicity, and environmental factors, i.e., sexual activity, exercise regimes, diet, etc. Among the most common preventative screens ordered by your doctor for you are a bone density test to measure bone health, mammogram for breast cancer, colonoscopy for colon cancer, specific series of blood testing to monitor obesity, family history for diabetes, vaccinations for pneumonia, shingles, hepatitis B or C, RSV, COVID, flu, gynecological exam, PAP, cytology for HPV, cervical or vaginal cancer, PSA test for prostate cancer, CT scan for lung cancer for past or present smokers, stress test or visual imaging of heart to determine risk of cardiovascular disease, HIV for sexually active patients having unprotected intercourse, sexually transmitted diseases, STD for sexually active patient, having unprotected sex and/or multiple partners, the screening type, delivery frequency, risk of occurrence, gender, age, and specific health factors at which these preventive measures are recommended are currently evaluated by the United States Preventive Services Task Force. The current screening guidelines are not listed here because they are subject to change as we obtain more scientific information about diseases and updated statistical outcomes regarding the use of preventive measures and their effectiveness. Most, but not all, screenings are covered by insurance because they increase the likelihood of detecting disease in its earliest stages when health intervention and outcomes are most successful. Early treatment is of benefit to both the patient, health providers, and insurance companies. It is essential to discuss these preventive measures with your doctor. They may be able to direct you to counseling, education services, or accurate and reliable internet resources. Being proactive in scheduling these screenings means you should have the name and phone number of the facility where the testing will take place before leaving the doctor's office. If your doctor's office is going to schedule the appointment for you, make sure to follow up a day to two later to confirm the appointment has been made and that the scheduled date and time are convenient for you. Whether you have a specific or general health issue you would like to discuss during your appointment, it is a good idea to prepare before visiting the doctor. Because time with a physician or her nurse is often limited, you will want to have any questions you have written in advance. The doctor will appreciate your forethought and you will have time to have your questions answered. During your exchange, you need to remember that the doctor is providing you with a service which you are paying for. Respecting the doctor's time is essential, however, not at the expense of your understanding of the answers to your questions or concerns. Learn to be proactive. If the doctor's explanation is not clear or full of medical jargon, ask him/her to reframe or clarify their response. If you feel the response you received did not answer your concern completely, ask a follow-up question. While none of us wants to appear ignorant, you are not a healthcare professional, and you cannot be expected to know what you don't know. A good strategy to use when having a conversation with your doctor is to verbally repeat your understanding of the doctor's response. This technique will confirm that your understanding of the medical issue is correct or provide your physician with the opportunity to correct your misperception. If you are not able to have a good experience with your primary care doctor, consider looking in-network for one who better meets your needs. Remember, having a good communicative relationship with your primary care doctor may be the difference between enjoying optimal health or living under less than optimal conditions. Maintaining good health over your lifetime is an active process, and you as an active participant must be proactive on the many multifaceted aspects that comprise of your life. It is important to recognize that good health or personal wellness is not just the absence or presence of disease.